15 symptoms that may indicate HIV infection. Human immunodeficiency virus, HIV infection can manifest in various ways, and often its early signs are subtle and easily mistaken for symptoms of other illnesses. However, recognizing these early signs is essential to seek proper diagnosis and treatment. In this Your Health video, you will learn about the 15 main symptoms that may indicate the presence of the human immunodeficiency virus. We will explore each one in detail so that you can stay alert and seek medical help as soon as possible, if necessary. Number 1. Excessive fatigue. Excessive fatigue is often one of the first warning signs that may appear after infection with the human immunodeficiency virus. This type of fatigue is not the usual tiredness that improves with rest. Instead, it is a deep and persistent sense of exhaustion that remains, even after a full night of sleep or a day of rest. The body, in its attempt to defend itself, enters a state of constant alert, using large amounts of energy to combat the virus. As a result, the person may feel drained, both physically and mentally, without a clear reason. This overwhelming fatigue may last for several days or even more than 1 week. It can become so intense that performing basic daily tasks, such as going to work, cooking meals, cleaning the house, or walking short distances, feels unusually difficult or even impossible. It may be accompanied by a feeling of weakness, lack of motivation, or difficulty concentrating. What makes HIV-related fatigue particularly concerning is that it does not improve with sleep, naps, or rest. It is a sign that something deeper is affecting the body. When the immune system is working overtime to fight an unfamiliar threat like the human immunodeficiency virus, fatigue can be one of the first physical symptoms to appear. Anyone experiencing this type of persistent exhaustion, especially when combined with other symptoms, should seek medical attention as soon as possible for proper evaluation and diagnosis. Number 2. Body sores. The appearance of body sores or skin rashes is another early symptom that may indicate infection with the human immunodeficiency virus. These skin changes often vary in appearance and intensity. In some individuals, the lesions show up as small red spots that may be flat or slightly raised. In others, they may develop into larger, more widespread areas of irritated or inflamed skin. These rashes can appear in different regions of the body, including the arms, legs, torso, and face. The discomfort caused by these lesions may include itching, burning, or general skin sensitivity. In many cases, the rashes are not limited to a single area. They may spread and remain visible for 1 week or more, depending on the individual's immune response and the stage of infection. Unlike allergic reactions or other common skin conditions, these rashes are often linked to systemic changes occurring in the body as it reacts to the virus. The human body, when under attack from a virus such as the human immunodeficiency virus, activates its immune system to fight off the invader. As a result, the appearance of rashes may be one of the first visible signs that something abnormal is happening internally. Anyone who notices unexplained skin rashes, especially when accompanied by other symptoms, should seek medical evaluation for proper investigation and diagnosis. Number 3. Sore throat. Sore throat is a common symptom that may appear in the early stages of infection with the human immunodeficiency virus. Unlike bacterial infections such as streptococcal pharyngitis, which typically present with white spots or visible pus on the tonsils, the sore throat related to HIV is different. In these cases, the throat often appears intensely red, swollen, and inflamed, but without the presence of secretions or visible lesions. This pain is caused by the body's inflammatory response as it tries to fight off the virus. When the immune system detects the presence of a viral threat, such as the human immunodeficiency virus, it reacts by increasing blood flow and immune activity in the affected areas, including the throat. As a result, this inflammation causes discomfort, irritation, and pain when swallowing or speaking. The sore throat linked to HIV infection tends to persist for several days and may not improve with common treatments, especially antibiotics, since it is viral and not bacterial in origin. In many cases, it is accompanied by other symptoms such as low-grade fever, fatigue, and swelling of the lymph nodes in the neck region. In many cases, it is accompanied by other symptoms such as low-grade fever, fatigue, and swelling of the lymph nodes in the neck region. In many cases, it is accompanied by other symptoms such as low-grade fever, fatigue, and swelling of the lymph nodes in the neck region. In many cases, it is accompanied by other symptoms such as low-grade fever, fatigue, and swelling of the lymph nodes in the neck region. Although sore throat is a symptom commonly associated with less serious illnesses, in the context of HIV infection, it becomes an important warning sign. When it occurs together with other unusual or persistent symptoms, medical evaluation is strongly recommended to identify the underlying cause and begin proper care as soon as possible. Before we continue, make sure to subscribe subscribe to our channel and activate the notification bell so you do not miss any of our health content. And remember, keep watching this video until the end to learn all the symptoms that may indicate infection with the human immunodeficiency virus. Your health and knowledge are important. Let us continue. Number 4. Swollen lymph nodes. Swollen lymph nodes are one of the most visible and important signs that the body may be fighting a serious infection, such as the human immunodeficiency virus. Lymph nodes, also known as lymph glands, are small, bean-shaped structures located throughout the body. They play a vital role in the immune system by filtering out harmful substances and producing cells that help defend against infection. During HIV infection, the virus triggers a strong immune response. In this process, the body increases the production of white blood cells, and the lymph nodes become active centers of defense. As a result, they may become swollen, enlarged, and even painful to the touch. This condition is called lymphadenopathy. Swelling is most commonly observed in the neck, armpits, and groin. Swelling is most commonly observed in the neck, armpits, and groin. Swelling is most commonly observed in the neck, armpits, and groin. It may occur on one side of the body or on both, and the lymph nodes may feel soft, firm, or rubbery. In many cases, the swelling lasts for several weeks and may persist even when other symptoms disappear. Unlike temporary swelling caused by mild infections, persistent lymph node enlargement, especially when combined with other symptoms such as fever, fatigue, or sore throat, should not be ignored. Number 5. Night sweats. Night sweats are a frequent and significant symptom in individuals living with the human immunodeficiency virus. Unlike regular sweating caused by high temperatures or heavy blankets, night sweats related to HIV tend to be intense, unpredictable, and persistent. This type of sweating occurs as a direct result of the immune system's constant effort to respond to the presence of the virus in the body. The body, when trying to control an infection, may experience changes in temperature regulation. This leads to episodes of heavy sweating that occur during sleep, even when the room is cool or the person is lightly covered. These episodes may last for several consecutive nights and are often so severe that the individual wakes up with completely soaked clothes and bed sheets. This symptom can be extremely uncomfortable and disruptive to sleep quality, resulting in fatigue and irritability during the day. More importantly, it is a sign that the body is in a state of ongoing immune activation. While sweating at night can have various causes, night sweats associated with HIV usually do not improve without medical attention. When night sweats occur together with other symptoms such as fatigue, fever, or swollen lymph nodes, they may be one of the first signs that the body is dealing with a serious viral infection. Anyone experiencing this kind of persistent sweating during sleep should seek a professional medical evaluation to determine the underlying cause and receive proper care. Number 6. Fever and chills. Fever and chills are among the most common symptoms that may appear in the early stages of infection with the human immunodeficiency virus. Fever is the body's natural response to a viral threat. When a virus enters the system, the immune response is activated, and one of the ways the body tries to defend itself is by raising its internal temperature. This increase in temperature helps slow down the replication of the virus and signals that something is wrong. In people infected with the human immunodeficiency virus, fever is usually low grade, but it can appear suddenly and without an obvious cause. It may last from a few days to up to 2 weeks. Often the fever is accompanied by chills, which are sensations of cold and shivering that result from the rapid temperature changes inside the body. These symptoms, although common in many viral infections, become more significant when they persist or are combined with other signs such as fatigue, night sweats, or swollen lymph nodes. Chills may come and go throughout the day and are often more intense during the night or early morning hours. Fever and chills may seem like minor symptoms, but in the context of HIV infection, they are clear indications that the body is fighting something serious. Anyone experiencing these symptoms for several days, especially alongside others, should seek medical evaluation to understand what is happening and begin proper treatment if necessary. Number 7. Diarrhea. Diarrhea is a common gastrointestinal symptom in people living with the human immunodeficiency virus. It occurs when the virus affects the digestive system, particularly the intestinal lining, which plays an essential role in absorbing nutrients and maintaining fluid balance. When this lining is compromised, it may lead to frequent loose and watery stools. This symptom can appear in the early stages of infection and may persist for several days or even weeks. In some cases, it becomes chronic, significantly impacting daily life and overall health. Diarrhea caused by by the human immunodeficiency virus may also be accompanied by abdominal cramps, bloating, nausea, and a general feeling of discomfort in the digestive region. Because of the loss of fluids and essential nutrients, diarrhea may quickly lead to dehydration and unintentional weight loss. These effects weaken the body even further and can compromise the immune response. In people with a weakened immune system, such as those living with the human immunodeficiency virus, the risk of complications increases if the condition is not treated properly. Diarrhea may also be a side effect of antiretroviral treatment or other medications used during the course of HIV care. Regardless of the cause, persistent or recurring diarrhea should always be taken seriously. Anyone experiencing this symptom should seek professional medical care to identify the underlying cause and receive the appropriate treatment to avoid further health complications. Number 8. Mouth ulcers. Mouth ulcers are a frequent symptom in individuals living with the human immunodeficiency virus. These lesions are small, painful sores that can develop on the tongue, inner cheeks, lips, gums, or the roof of the mouth. They may appear as isolated spots or in clusters and often cause discomfort, especially when eating, drinking, or speaking. In the context of HIV infection, mouth ulcers are caused by the immune system's weakened ability to control inflammation and defend against common irritants or infections. These ulcers are usually round or oval in shape, with a red border and a white or yellow center. They may range in size and persist for several days or even longer, depending on the individual's immune response. The presence of mouth ulcers may be one of the first visible signs that the immune system is under strain. In addition to physical discomfort, these sores can lead to difficulty with proper nutrition, as eating may become painful, especially when consuming acidic, spicy, or hot foods. Although mouth ulcers can also result from other factors, such as stress, hormonal changes, or minor injuries, persistent or recurring ulcers should never be ignored. When they appear along with other symptoms of HIV, such as fatigue, fever, or weight loss, they become an important signal. Anyone experiencing frequent or long-lasting mouth ulcers should seek medical attention to identify the cause and begin the appropriate treatment. Number 9. Joint pain. Joint pain is a symptom that may affect many people living with the human immunodeficiency virus. This type of pain can appear in various parts of the body, including the knees, elbows, wrists, fingers, ankles, and shoulders. The discomfort may vary in intensity, ranging from mild and intermittent to strong and persistent, and can significantly interfere with daily activities. In the case of HIV infection, joint pain may occur for several reasons. One possible cause is the chronic inflammation triggered by the immune system's ongoing battle against the virus. As the body tries to defend itself, this constant immune activity may lead to inflammation in the joints, resulting in pain, stiffness, and swelling. Additionally, people living with human immunodeficiency virus may be more susceptible to conditions such as arthritis or autoimmune reactions, which also affect joint health. Certain antiretroviral medications may contribute to joint discomfort as a side effect, further complicating the picture. The pain may worsen in the morning or after periods of rest, and sometimes improves with light movement or physical activity. However, in more advanced cases, the pain can limit mobility and reduce quality of life. Joint pain should not be ignored, especially when it appears together with other symptoms such as fatigue, fever, or muscle aches. A healthcare professional should evaluate the condition to determine the underlying cause and recommend the appropriate treatment to reduce inflammation and restore comfort. Number 10. Unintentional weight loss. Unintentional weight loss is a serious and often alarming symptom that may be associated with infection by the human immunodeficiency virus. This type of weight loss happens without any effort to lose weight and is not explained by changes in diet, physical activity, or lifestyle. In many cases, it is one of the first signs that something is wrong within the body. People living with HIV may experience a significant drop in weight due to several factors. One of the main causes is the body's increased energy consumption while fighting the virus. At the same time, the infection may reduce appetite, impair nutrient absorption, and cause gastrointestinal symptoms such as diarrhea and nausea, all of which contribute to weight loss. The loss of muscle mass, known as wasting, may occur gradually or quickly, depending on the progression of the virus and the individual's immune response. This physical decline can lead to weakness, fatigue, and a noticeable decrease in strength and physical performance. Weight loss is not just a cosmetic concern, it is a clear sign that the immune system is under stress, and that the body is not receiving or using the nutrients it needs. When weight loss is accompanied by other symptoms such as fatigue, fever, or frequent infections, it becomes even more urgent to seek medical evaluation. Early intervention can help stabilize the condition, preserve strength, and improve quality of life. Number 11. Neurological problems. Neurological problems may occur in individuals living with the human immunodeficiency virus, especially as the infection progresses and begins to affect the central nervous system. These issues can range from mild cognitive difficulties to more severe conditions, depending on how the virus interacts with the brain and nervous tissues. One of the early signs may be frequent headaches, which often do not respond well to common pain medications. Other symptoms may include difficulty concentrating, confusion, memory loss, and reduced ability to focus on tasks. In some cases, people may feel mentally slower or struggle to follow conversations and complete routine activities. More advanced neurological complications can include mood changes such as depression or anxiety, and even motor difficulties, including problems with balance, coordination, or muscle control. In rare but severe situations, the virus may lead to conditions like encephalitis, which is inflammation of the brain, or HIV-associated dementia, a serious cognitive disorder. These symptoms occur because the human immunodeficiency virus can cross the blood-brain barrier and trigger inflammation in the nervous system. When the brain and nerves are affected, normal functions are disrupted, and the individual's mental and physical performance may decline. Anyone experiencing ongoing neurological symptoms, especially when accompanied by other signs such as fatigue, fever, or weight loss, should seek immediate medical evaluation. Early diagnosis and proper treatment are essential to manage these complications and prevent further damage to the nervous system. Early diagnosis and proper treatment are essential to manage these complications and prevent further damage to the nervous system. Number 12. Opportunistic infection. Opportunistic infections are a serious concern for people living with the human immunodeficiency virus. These infections are called opportunistic because they take advantage of a weakened immune system, which is no longer able to defend the body effectively. As HIV progresses and reduces the number of defense cells, the body becomes more vulnerable to illnesses that normally would not pose a threat to healthy individuals. Some of the most common opportunistic infections include pneumonia, tuberculosis, fungal infections, and certain types of viral conditions that are typically controlled by a strong immune system. These infections may affect the lungs, skin, brain, digestive system, or other vital organs. In some cases, they can become life-threatening if not detected and treated quickly. Symptoms of opportunistic infections vary depending on the type and location of the infection. They may include persistent cough, fever, weight loss, diarrhea, skin rashes, or neurological changes. Because these infections tend to appear when the immune system is already compromised, they can be more difficult to treat and may require specialized medical care. The appearance of opportunistic infections is often an indication that the infection with the human immunodeficiency virus has advanced and is approaching the stage known as acquired immunodeficiency syndrome. For this reason, early diagnosis, regular medical follow-up, and strict adherence to antiretroviral treatment are essential to prevent these infections and preserve overall health. For this reason, early diagnosis, regular medical follow-up, and strict adherence to antiretroviral treatment are essential to prevent these infections and preserve overall health. For this reason, early diagnosis, regular medical follow-up, and strict adherence to antiretroviral treatment are essential to prevent these infections and preserve overall health. Number 13. Menstrual cycle changes. Menstrual cycle changes can occur in women living with the human immunodeficiency virus and may be an early indication that the body is under physical and hormonal stress. These changes may include irregular periods, heavier or lighter menstrual flow than usual, shorter or longer cycles, or even the complete absence of menstruation, a condition known as amenorrhea. Causes of these alterations are varied. The presence of the virus itself, combined with the body's immune response and overall physical condition, can interfere with the normal functioning of the reproductive system. In addition, emotional stress, nutritional deficiencies, and weight loss, which are common in people living with HIV, can further disrupt hormonal balance. In addition, emotional stress, nutritional deficiencies, and weight loss, which are common in people living with HIV, can further disrupt hormonal balance. In some cases, menstrual changes may occur before a formal diagnosis of HIV is made, and are often overlooked or attributed to other factors such as anxiety, age, or lifestyle. However, persistent irregularities in the menstrual cycle should always be evaluated, especially when accompanied by other symptoms such as fatigue, weight loss, or frequent infections. Although menstrual changes do not affect all women living with HIV, they are an important warning sign that the body's internal systems may be out of balance. Any woman experiencing unexplained or ongoing changes in her menstrual cycle should seek medical advice to identify the cause and receive appropriate care, ensuring her overall health and hormonal stability. Any woman experiencing unexplained or ongoing changes in her menstrual cycle should seek medical advice advised to identify the cause and receive appropriate care, ensuring her overall health and hormonal stability. Number 14. Mental fatigue and stress. Mental fatigue and stress are symptoms that often affect people living with the human immunodeficiency virus, even in the early stages of infection. While physical fatigue is more easily recognized, mental exhaustion can be just as debilitating, interfering with concentration, memory, decision-making, and emotional stability. This type of fatigue is not simply a response to a busy schedule or lack of sleep. Instead, it is a result of the body and mind being under continuous pressure, both from the virus itself and from the emotional impact of dealing with a chronic condition. The immune system's constant activity, combined with worries about health, future, stigma, and daily challenges, contributes to a persistent sense of mental strain. People experiencing mental fatigue may feel unmotivated, emotionally drained, or overwhelmed by tasks that were once manageable. This condition can also lead to symptoms such as irritability, anxiety, sadness, or depression. In some cases, individuals may begin to withdraw socially or lose interest in activities they once enjoyed. Mental fatigue should never be ignored, especially when it occurs alongside other symptoms of HIV, such as physical tiredness, sleep disturbances, or changes in appetite. Addressing mental health is a key part of living well with HIV. Seeking psychological support, practicing self-care, and maintaining a strong social network can make a significant difference in managing this symptom and improving quality of life. Seeking psychological support, practicing self-care, and maintaining a strong social network can make a significant difference in managing this symptom and improving quality of life. Seeking psychological support, practicing self-care, and maintaining a strong social network can make a significant difference in managing this symptom and improving quality of life. Number 15. Nausea and vomiting. Nausea and vomiting are common symptoms experienced by individuals living with the human immunodeficiency virus. These symptoms may occur during the early stages of infection or develop later as a result of the virus's progression or the side effects of antiretroviral treatment. Nausea is often described as a persistent sensation of discomfort in the stomach, which may or may not lead to vomiting. Vomiting, in turn, is the forceful expulsion of stomach contents and can be triggered by the virus itself, medications, infections, or digestive system irritation. These symptoms can interfere with regular eating, hydration, and nutrient absorption, potentially leading to weight loss, weakness, and dehydration. In many cases, antiretroviral medications are the cause of gastrointestinal side effects. When treatment begins, the body may take time to adjust to the medication, and nausea is a common reaction during this phase. However, in other cases, the virus may affect the gastrointestinal tract directly, contributing to recurring nausea and vomiting. It is important to monitor the frequency and intensity of these symptoms. Occasional discomfort may be manageable, but ongoing or severe episodes should always be reported to a healthcare professional. Proper medical evaluation can help identify the underlying cause and adjust medications or provide supportive treatment. Managing nausea and vomiting is essential to maintaining adequate nutrition, hydration, and overall well-being for people living with the human immunodeficiency virus. Now that you have learned about the 15 main symptoms that may indicate infection with the human immunodeficiency virus, it is important to remember that early recognition can make all the difference. Paying attention to your body, understanding the warning signs, and seeking professional medical care as soon as symptoms appear are essential steps toward maintaining your health and preventing complications. The human immunodeficiency virus affects each person differently, and symptoms may vary in intensity, duration, and combination. That is why being informed is one of the most powerful tools you can have. Whether you are caring for your own health or supporting someone you love, knowing what to watch for is a vital part of protection and prevention. If this content from Your Health helped you understand more about the early signs of HIV, do not forget to support our work. Click the like button, share this video with friends and family, and make sure to subscribe to Your Health. Activate the notification bell so you never miss our future videos, always focused on health, awareness, and quality of life. And most importantly, stay with us. Keep watching to explore more videos suggested on your screen.